nitakungoja, nitakungoja, ninakungoja Yesu, ninakungoja, 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 nitakungoja Yesu, nitakungoja, 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 ninakungoja Yesu, ninakungoja, ninakungoja, ninakungoja.
It's so nice to be here this afternoon. This is Midweek Vibes, and we are so delighted to be hosting you this afternoon. And our topic today is the COVID vaccine. And we shall be exploring your say. What's your say on this vaccine? And with me on stage today to shed light on this matter are three amazing people. On my right is a businessman, and I'll let him introduce himself. Please, if you could introduce yourself.
Hi everyone, my name is Tapua Ndongwe. I'm an entrepreneur. I'm an energy developer in renewable energy. Yes, and it's a pleasure to be here. Thank you.
Karibu sana, we are so delighted to have you and we're looking forward to hearing what you are saying. Yes. Next to me is a medical practitioner. Please, Daktari, introduce yourself.
Okay, thank you very much. Hi everyone. My name is Frida Njogundongwe. As Maggie said, I'm a medical doctor and public health practitioner. I'm really pleased to be here. Thank you.
Karibu sana. Again, our joy to have you. And on my left is another Daktari. Please introduce yourself.
Hi everyone, my name is Kenneth Ogendo. I'm a public health specialist and a life and fitness coach, and I'm happy to be here, Maggie.
Karibu sana. And we are coming to you from Mamlaka Hill Chapel. This is our local campus, and we shall be hearing what the experts also have to say about the virus. So without much further ado, I just welcome you again. And our audience, karibuni sana, tell your friends, let us know whether you have questions, send them to us, and we shall seek to have our experts address them. So guys, this vaccine comes against a backdrop of a disease, the COVID-19 disease. And let's just hear what's been going on in your field, in your lives, in your families. Let's start with Dr. Frida.
So that's a loaded question. I think we are all by now quite familiar with the COVID disease, which is caused by the coronavirus virus, and I think it's really turned our world upside down. It's it's here. It's and we're currently in the third wave of it. We've had very many. I think early in the pandemic, we knew of the numbers. I think as time has gone, we have actually put faces and names to those people, and it's actually come to be us, you know, or family members or loved ones who are affected by it. But also it's affected, many things, school, work, just the way we do life, even church and so on. So I think that's really, I think it's here with us. We need to acknowledge that fact and see, how to best protect ourselves, how to best, protect our loved ones and the society at large, really, as we continue to plead with God to please take it away.
Yeah. And from your corner, Ken, what has been happening?
So for me, I look at COVID-19 as a major global public health event. And I was talking to some friends. I've seen a lot of positives and negatives. For example, we were just discussing how pollution has reduced globally.
Yeah.
You've found some animals that were never seen are actually being seen on the streets in quite a number of countries. And even in Kenya, I'm told some animals can actually be seen close to the road. So I would say coronavirus has brought down pollution in a big way, and it has also affected the way we work. And I agree with Frida that for where I work, we are now working more from home.
Yes.
And we have to reset. There's a new normal, and we have to adopt new ways of working, new ways of operating. Of course, I've suffered mental health because of everybody, not that I've gone mad, but everybody has. Everybody's been affected mentally.
Yes.
As long as you're on Zoom calls and Teams calls, they can really be fatiguing.
Yes, indeed.
On the other hand, I spend more time with my kids and wife, and so I see it in all ways.
Right. Yeah, thank you so much. But from your corner, Tapua,
Yes.
how has this affected you at a personal level?
Okay, first of all, I'm married to Dr. Frida here. It's quite an honor. Yes, yes, but it also affected us as well as a couple. We've got 3 children, been married 11 years, but she, and November last year, Frida actually tested positive. And it was a bit devastating because you'd naturally think that, since, with the social distancing and we're married and we're together, you would think that both of us the likelihood of both of us being positive were higher. But actually, when we were tested at the same time, she was positive and I was negative. So it was a big lifestyle change, you know, with the isolation. I had to move out of the room, our matrimonial room. Yes. So yeah, but we just had to do what we had to do to ensure that we combat this thing and it doesn't spread. Yes.
So you made adjustments right inside the home.
Yes.
And
yes.
did you have to take care of Frida?
Yes,
How did
yes.
that
So Frida took over the room. Fortunately, she didn't have major symptoms. So I remember we got the results on a Saturday afternoon, 4 p.m. And immediately we got those results. I had to move out, get a spare mattress, get my clothes out, etc. Had to get PPE. She fortunately she had her own bathroom so it was easier for me to move out. But yeah, I mean, just the weekend was just gone, you know, just trying to adjust and I remember now, she was even quite conscious about what she's able to touch. She can't see her children anymore for those 2 weeks, you know, because I mean that's what the protocols dictate, right? So yeah, so we had to. It was a bit devastating, but you know, you don't even have time to process it all because you just automatically go into that. Into the mechanics of it, you know, isolation, PPE, and the like. Yes.
And you forgot you'd have to deliver food to me at the door. He actually moved a desk into the room so I could work from there. We did Bible study on Zoom with the kids, just so we would see them. At some point that you had to move out with the children, I think for about a week or so. But we thank God that the whole family tested negative. But I think the care in terms of getting me everything I require, also taking care of the kids was quite a bit of a burden. For him.
Wow, we celebrate you guys for that aspect. Letting us into your story in that sense, and learning to cope that quickly, because that's what is needed, isn't it? And Frida, here you're a mom and the kids can't come near you. How was that like?
It was actually difficult because you'd hear them on the other side of the door. Mommy, especially the baby. We have a baby who was 2.5 then, and his brothers are a little older. Yeah, and they struggled. I mean, the older ones, we told them about it. They asked, "Are you going to die?" So we had to tell them no. We don't. Well, we had to tell them no, but we also praying it doesn't end up there.
Yeah.
But at least I think doing Zoom or WhatsApp calls with them, video calls helped. Yeah, but I think we actually sat them down and told them this is what it means, that mommy is sick, she's not going to die, but she needs to be away for this long.
Right.
And then you guys, this is how life is going to be for the next few days. We got a lot of support, I mean, from family. We had family dropping food every day. Other, medics in the family also just helping in very many ways. So I think that really helped. I think the whole society, the community, and especially family came around us. So that helped.
Wow, we really thank God for you. And before we come to Ken, Tapua, your mom was unwell.
Yes. So this was when Frida was tested positive. That was in November. Then in February this year, my mom. I'm originally from Zimbabwe, so my mom is in Zimbabwe. So she also started having flu-like symptoms, but unfortunately that time she downplayed it because we have this mentality. We always think that this COVID thing is a foreign thing. It can never affect us. So I think she took it for granted, and now this flu, the symptoms escalated to the point where she actually had to be hospitalized, and I had to drop everything here and go to Zimbabwe and to take care of her and ensure that she gets the proper care in hospital. It was quite an experience, traumatic experience, because by the time I got there, she had already, the symptoms had escalated. She was having difficulties breathing, etc. Even when my cousin took her to the hospital, the, even the doctor said we have to intervene. She has to be admitted. She was downplaying it, taking it for granted. She's like, no, we don't. So there's this saying of, parents, we don't want to inconvenience the kids. But already by that point, if we had known earlier, would have intervened. So yeah, but fortunately, we thank God, she was there for 1.5 weeks, and she recovered. She was discharged. But yeah, it was really really bad. Yeah, at that time. Yeah.
So being there twice to support the special ones around you,
Yes.
it's remarkable. Now, Ken, when we look at the third wave, I think you used the word, sometimes you are a little relaxed. This third wave, what does this show about our, our responsiveness to the virus as a community?
Yes, maybe as I look at that, I think these guys have inspired me to remember how did I last relate with COVID at home. And maybe Pastor Maggie, I just remembered one time when I had this bout of diarrhea, in public health, we just say it as it is, yeah?
Yeah.
And I told my wife, hey, man, this is one of the symptoms of the COVID.
Yeah.
And also, that time, we were talking a lot about home-based care, and she got me this pulse oximeter. So she got it home, and then we were now checking my oxygen levels at night. So she woke up at night to just check. She didn't want to find me dead in the morning, so she was checking. Then she found I was below 90. Then she was really scared. So she checked hers. Hers was actually lower than mine. Now she was like, now both of us are sick. But again, the thing about pulse oximeters, your body needs to be warm. There's a way you use the oximeters so that you can check whether the oxygen levels are fine. So remember, we were really scared. And now in the morning when I was moving up and down, I checked I was fine. But that made me go for a test. So, a pulse oximeter is good to have. But it challenged. It made me see that my oxy loves me. So just any of these guys are together here. I just wanted to chime in your conversation. Anyway, now back to you on your question on
but
the third
before
wave.
you go there,
Yes.
that's a good point. The oximeter.
Yes.
Is there a way you use it properly or not properly, and you can get the right readings?
Yes,
Is that something you could tell
when your body
our
is
audience?
at rest and maybe a bit cold, oxygen is supplied in the whole body by the way the blood circulates. So when you're at rest and you're not so active, the pulse oximeter might actually be below 95, and you can really get scared. And right now, because of the stress of the health systems right now, globally, people need to have an oximeter at home so that you can be tracking this. In the event you have other symptoms, it's good to have an oximeter with you at home. Some cost around 1,500, 1,000 shillings, depending. It's a good tool to have alongside the thermometer that you mentioned. And so that you can track, so that you don't go to the hospital when it's too late.
Yes.
So it's a good tool to have, and you need to use it in the right way. Wait for, inside your finger, and wait for a minute or so, and then it will give you all the readings. So if you're below 95, actually below 90, then you need to go and be checked at the health facility. Yes.
Thank you. Guys, you've heard it from a public health practitioner. It's a good thing to have the oximeter, and you check it right. But I think when you check it when your husband is sleeping, he'll be at rest, so he may not get the right reading. I think it's good to have him wake up a little. Our husbands also checking their wives at night?
Yeah, we love our wives, but yeah, we also respect their space as well. We don't want to wake them up.
Let's go to the third wave.
So to the third wave, we're just sharing. Right now, Brazil has one of the variants for the COVID-19, and it's now producing 100,000 cases in Brazil. In fact, at the moment, the hospital system in Brazil is shutting down.
So did you say
100,000
cases per day?
Per day. We were actually astonished when US had like 1,000 cases per day, and that was very dangerous and alarming globally. But now Brazil, just below US, they have a huge problem, and now you find ambulances are rushing people to the hospital and they can't find them. And I remember our good Senator CS Mtai Kagwe asking guys to take the oxygen cylinders back to where they need to be refilled so that we can save more lives.
Okay.
So you find, as much as you might think, were we not prepared as Kenyans? Well, you find even the US, I mean the Brazilians, even Italy, the third wave is actually stressing the entire health system because now they have to become engineers. They're trying to connect pipes behind the walls just to make sure that they're able to supply oxygen to as many patients as possible.
Yes.
So the third wave has got several variants. In Kenya, we don't have the intensity we have in Brazil. The Brazilian variant is a huge health risk globally. And if we do not take care of it, it's likely to get to other places. In fact, they have like 41 countries have this variant. And we also have the UK variant and the US one. And Kenya, we have the one that, has been circulating in Africa.
Our local.
So I would say we are also trying to learn the times. For some time, people have been wondering, why do we have this upsurge all of a sudden? Our kids are going back to school. We were actually having businesses open. People were going to churches. And then the president had to put in a hard stop and say, hey, guys, we have to wait and see. So from an epidemiology perspective, yes, Africa, we are very young. The median age of an African, this is 25. In Kenya, we are at 19 years, median age. But for a country like the US, the median age is 47. So you find they have been having higher cases of death because of the elderly who are exposed. And for us, you have a younger population. And again, you find the virus does not survive very well in humid and hot climates. So you find we are not as predisposed as those people who are in winter in other places. And so those are the things that we need to be looking at. Now, naturally, even without COVID-19, towards February, March, just before the long rains, we usually have so many cases of flu.
Yes.
If you remember, even before COVID.
Yeah, even before COVID.
Yeah, April they go up and then they go down.
Yeah.
And then around June, July, when it's getting cold again those cases go up. So there's a sense in which coronaviruses, actually, did you know we've been having coronaviruses all along, just that this one is virulent. If I was to break it down for the layman, we have like the coronavirus family there are 7. Seven kids, they didn't do family planning. Corona didn't do FP, So they're like 7 kids. Now 4 kids have been giving us the normal colds that we usually have, and you just fight with the immunity. Just take ginger, lemon, hot water, and you're good to go.
Good.
But we have SARS, now the SARS-CoV-2, this COVID-19. We had H1N1 2009. Guys, you remember that? We also had the MERS-CoV 2012 in Middle East. And now this one from China. So the MERS-CoV one and this one are the most virulent of the 7 kids under Corona, the Corona family.
So these are the last kids.
Those are the last kids, the last stubborn kids,
the
very
most
virulent.
stubborn, yes.
And because of mutation, we have taken so long to get the vaccine on, so they are mutating. Like in Brazil, US, those guys have had so many variants because of the mutation. So that's why you're fearing for Africa. So this is what that wave is premised on that. And we are hoping that for Africa, God will keep us safe as usual. Because our health systems are not as good as there. So we hope we should still keep washing our hands and everything.
So, and maybe you come to that in a bit of what we need to do, even as we trust God to keep us safe, the things we need to keep doing every day. Yes, Frida.
No, I just wanted to jump in and say, so for sure, we have the variants, including the South African variant, I think has been detected in quite a few cases. And some of these variants might be more likely to spread, but also sometimes have, some more severity. But I think, so that's one. That could be one of the things that's driving. But also I think our behaviors have changed. Honestly, Kenyans are not taking, those protective measures anymore. We are not wearing masks. Even indoors, we are not, and I think probably, in my opinion, that's probably one of the more important measures. Even, I know everyone talks about washing hands, sanitizing, and that's important. But actually, it's when you maybe cough or breathe out. So there's a lot of aerosol spread as well, especially indoors. So, leaving, windows open here, I'm happy that it's really almost outdoors, really. So we're congregating indoors. We're not wearing our masks. All those safety measures, we've stopped doing them. I think that's contributing significantly. I think we have a bit of a casual attitude towards towards COVID. So there's that. Also, right now our ICUs are full. We were having a discussion with you, Ken, earlier. They are full, and these are much larger number of ICUs than ICU capacity than we had at the beginning.
Yeah.
So there's both the virus factor, but also there's our behavior factor that's contributing towards the third wave, and we need to do something about it. Yeah, and like for instance, in the urban areas, we live in indoors. In the rural areas, people tend to live outdoors, which helps. Because if I'm going to meet with you, I would rather be outdoors where the wind is blowing, you know. So if we're able to spend more time outdoors, then that significantly helps. I think also the schools might have contributed towards the surge in cases. I don't think that necessarily. Anyway, so there's a whole policy argument between the pros and cons of not opening schools. So I don't think I'll go into that, but I think just discussing about whether we what really is triggering the third wave. Yeah, it's both the virus and our behaviors really.
I think that's a good point to discuss at another time because of the multiple ability for the virus to spread. When kids gather together, then they go back home. What do they take home? So that's a conversation for another day. I've heard it said that if you treat life casually, you end up a casualty. I've had something like that. Yeah. So I think that casualness needs to be checked, and I think we need to talk a little bit about home hygiene, because we talked about we live in indoors a lot in the urban centers. Could you say something about our need to keep the windows open? We close the doors, of course, we don't want the unwelcome guest. But is that a better idea?
Yeah, definitely. I think, and I hope, what we are learning now from COVID will also help us with TB, with other diseases that tend to spread indoors. But we need to develop a culture of opening, doors and windows as much as possible. I know sometimes it's cold, but anyway.
Can wear something warm.
It's also where we have selected to live,
Yeah.
But wear something warm and if possible, open the windows as much as possible. If you've had a guest, even if they had a mask and they leave, open the windows and doors, as much as possible. And also stay outside. If you have a balcony or a veranda, go there. Let your kids play outside. As adults, let's go for walks. I think we need to be more outdoors. People, it's also good generally even for mental health and exercise, but I wouldn't go into that. So there's that, but also just regular cleaning. If you suspect exposure, just sanitizing surfaces and stuff like that. Sanitizing microphones. I think even in churches, that's a place where this whatever can spread because we are, But really just anything that you handle, we need to be quite careful with that. And I think it'll help us even beyond COVID. Yep.
I can confirm that as a church, we are really stringent. Our mics are at the risk of being dipped in the in the sanitizer. They are actually very well sanitized, so we are safe as far as that is concerned.
Maybe I can chime in on that idea on behavior change. I totally agree with Frida that we have a huge challenge on behavior change. And in fact, I liken our work in public health to your work, Pastor Maggie, because we are behavior change advocates. We try to tell people it is a sin to use cash money. You'd rather use M-Pesa.
Yeah.
We have said that is a sin in light of COVID. It is a sin to, not maintain social distance. So we tell guys that these are the things that you need not to do, or you need to observe them. But guys keep on going back to them. And the challenge on all of us, you realize like last year when COVID was so new, we were masking up, social distance. Guys were almost paranoid. Then we have gotten so comfortable. And right now with the third wave, again, you're trying to look and dust, that information and try to do it one more time.
Yeah.
So just say behavior change is iterative. It's just like telling someone, hey, you've committed this sin, you need to get saved. They're like, no, I don't want to get saved, get saved next year. So guys are like, I'll start washing hands. Like there are 7 steps of washing hands. Close to 8, some say even 9. But to be honest, how many of us, I'm asking you guys, follow all those steps, including clasping and, even your fingertips, everything.
Brush.
It's a challenge, but we need to keep working at it without giving up.
I did not know there were 7 or 8 steps. I knew that you just need to sing Happy Birthday 2 times. And wash and wash and wash until you finish singing. I didn't know there were 7 steps. So we may have a chance to hear that at a later point.
Yes.
But we need to take a short break. And when we come back, we're going to look at the vaccine itself. We want to know, this is the season when the vaccine is available. It has come to our hospitals, and people are taking it. People have questions about this vaccine. So don't go away. We'll be right back.
Thank you.
Kama vile ayala atamanivyo maji kule jangwani na kungoja, kama vile ayala atamanivyo maji kule jangwani na kungoja. Kama vile ayala atamanivyo maji kule jangwani na kungoja, kama vile ayala atamanivyo maji kule jangwani
Welcome back. We are glad you stayed tuned. We shall look at the vaccine itself in this next half of the show. And we are delighted to still have our panelists ready to respond to our questions. And I think we'll go straight ahead and ask some questions that have been raised. One of the questions is, what's the cutoff for the vaccine in terms of age? Who can receive the vaccine? Who can't receive the vaccine in terms of pre-existing conditions or whatever it is that a person might have? So the first question is basically, can kids have a vaccine? Is there an age cutoff? The second question, is there something that can hinder somebody from having the vaccine for now?
Okay, thanks. I think those are very good questions, Maggie. Currently, the vaccines have not been studied in children. So they've not been given to children yet. That doesn't mean they will not be. Actually, studies are actually now ongoing. In fact, one of the vaccines is testing even in infants, so we will know. So we really, vaccination and the decisions to vaccinate the public is based on safety, on scientific research, and so on. So they cannot go ahead and say, let's vaccinate children until we have that safety data. So we are hopeful that maybe in the next few months we will know whether children can get them and which ones they can get. So for now, no children are being vaccinated. Generally, the vaccine is safe. It's recommended for everybody. The vaccines have not been studied in pregnant women. However, experts do not see why the vaccine would be unsafe in these women. But because we want to be guided by evidence, I think we will wait for that evidence to come through. I know some people, and especially if you're at high risk, you're a healthcare worker, and you're pregnant, this is something to discuss with your doctor, your gynecologist, and weigh the risks versus the benefits, and at that point make that decision with your gynecologist until we have vaccine trial data. That's what I would say, because it has not been trialed in pregnant women. But really, generally for everybody else, honestly, take the vaccine. It is safe, whether you have cancer, whether you have other pre-existing conditions. These vaccines have been found to be very safe, and they will protect you. I mean, those people with pre-existing conditions are at actually higher risk of more severe disease. So for sure, please take the vaccine. I have taken the vaccine, and I'm happy to talk about that later when we have an opportunity. But I really encourage. I know there's a lot of myths and misperceptions out there, but as a medic, I actually want to recommend that we take the vaccines. They are safe. They've been studied, and the safety profile is quite high. Thanks.
That's a good one, because one of the myths, you mentioned myths and fears, because they're genuine fears. If I'm pregnant, will I lose my baby? Or if I have a condition, or I'm sick, I am diabetic, for example, I have high blood pressure, will it be safe for me, or will it make the matters worse for me? So debunking that myth is very good for our audience. So thank you very much for that answer. One other fear that has been raised is the fact that this vaccine may not be innocent. It may carry something that can make me be controlled. So is that a legitimate fear? Can people be tracked by using or taking the vaccine? Is there an intelligent something in the vaccine?
Well, maybe to add on the myths and misconceptions, this vaccine does not cause infertility. And this vaccine does not cause infertility, does not cause the baby in the womb to get the virus, as people would think. There's somebody who did a funny study, I call it funny in quotes, saying that, this vaccine could actually go through the virus could get through the placenta, but the placenta is beautifully done by God. It cannot allow viruses to go to the baby, only nutrients. So pregnant women in those countries, like CDC has allowed pregnant women in the US to get the vaccine, but in Kenya we are saying only on doctors, like Frida was saying, on doctors' advice.
Okay.
And the other thing that I also want to mention, there are people who are asking, can you get the vaccine if you are already sick with COVID? If you have symptoms and you're sick, you need to wait and get healed so that you can go and get the vaccine. If you're sick with COVID-19, but if you've got cancer and other diseases, including tuberculosis, even obesity, by all means, those people's immunities are already compromised, just like those who have HIV. And they need the vaccine as soon as possible. And that's why the government of Kenya, by the way, has launched a 3-tier system of rolling out the vaccine. Of course, on phase 1, we have the frontline workers. Those are the health workers like myself and Dr. Frida, and they are the uniformed, disciplined people. And the government...
And the coloured people as well.
Yes.
Yeah.
And also yourself.
And the teachers.
And the teachers as well.
And the teachers, oh my goodness, all the people who are front-facing, all people interacting with Kenyans and population are the first ones to be taken care of. And also, recently, the president actually has expanded that to include all those people who are 58 years
and above,
because they are also at risk, especially given the third wave and these new variants that are coming on board. And then the second phase, earmarked to begin in June, is going to focus on the elderly and those with comorbidities.
Oh, okay.
And that's where the government will utilize all advocacy, social mobilization measures to make sure that everybody who is in the house and has got vaccine hesitancy comes on board. And then now the third phase will be focusing on the congregate setting. Those are the people who are in the tourism industry, the people who are in the entertainment industry. They'll come in within the third phase.
Okay.
So I would say the vaccine is approved by WHO. That there is also this other myth I wanted to mention to you. It's not a myth per se, depending on how you look at it, from infodemics, and also Frida can speak to it. The issue of blood clots. Some countries have disapproved of one vaccine because of those claims, but the World Health Organization has done extensive research showing that there's no causal link to that, and hence no Kenyan should fear taking the vaccine,
because of
hoping
that,
or believing that they're going to get blood clots. So that has been disapproved. And in fact, the Chancellor of Germany, Angela, she took AstraZeneca vaccine. And even France is taking it on board. Those countries that had said they're not going to take it, they are now taking it on board. And because the beauty about that vaccine, it can actually exist between 2 and 8 degrees Celsius, which is good for Africa. The Pfizer one in Moderna, they cannot exist in our setting as much as they would be cheaper to produce.
Oh.
Yeah, so back to you.
Oh, fantastic. That's very good. Frida, go
Yeah,
ahead.
thanks. There's something you asked about whether someone can be tracked. This, honestly, I think we've had, again, infodemic, that's what you call it, right? That there's a microchip in the vaccine. There is no, I had it, it's actually clear liquid. I had it administered about 2 weeks ago. There is no microchip in these vaccines. It's actually safe. And we vaccinate our kids against, our children take so many vaccines every day. I don't know why we are much more reluctant about this one, but it is a safe drug. No one is going to track your data or your whereabouts because you've taken the vaccine.
I just wanted to add on that as well. Just think of it this way. If you're worried about data security and your own personal information being shared, etc., being tracked, all those things. We all have smartphones, right? And we have embraced them. And from a technology point of view, it's easier to track you using a device that already has a microphone inbuilt, camera. It's got geolocation. It can track you easier. So, as a business person, right? If you there has to be a cost to benefit to anything, right? You just don't track for ill or nefarious reasons, but you actually do it with whatever intention, right? So it's actually easier to actually use already existing technology instead of inventing new ways. So I don't think there are any tracking chips, or if there are, but they are so cutting edge, they might be so expensive that you can actually put nanotechnology into each and every vial of vaccine. It's not worthwhile, right, from the value you want to get. So fear smartphones, I would say, more than the vaccine. If you're worried about data security. Yeah.
So fear is a big motivation here. But the encouragement is that it's safe, and we should be able to go ahead and get the vaccine. So talking about the vaccine, you received it. What was your reaction?
Actually, I didn't experience any side effect.
Oh, really?
We received it with my husband. He had fevers and I think a bit of pain at the site. I didn't experience any reaction, so I think it's varied. Some of the things some of the side effects you can experience include, pain or redness at the injection site, headache, muscle pains, fever, but they're generally clear within a couple of days. Maybe the soreness of the arm might last probably for a little more. Other people will not experience anything, and if you experience any of those, you can just take a Panadol. Really, it should help. Yeah, but we are not worried about significant side effects.
Side effects.
Yeah.
Right. So let's talk about HIV positive patients, for example, or people with other ailments. Like Dr. You said, you're saying illness should not be a deterrent. People should go ahead and take this vaccine because it will not interfere with other medicines they're taking. Is that right?
Yeah, that's correct. In fact, if we are to go back to the basics, you mentioned HIV. HIV in Swahili, in AIDS, means ukosefu wa kinga mwilini, ukimwi. So the body does not have protection for those who have got HIV. Even those who have got cancer and hypertension, the immunity is compromised. It is not up to optimum. And so these people, are the most susceptible or the most vulnerable people when it comes to the vaccine. So if they go to a place that is congested, when they go to a place that you've not opened doors well, or if they don't put on their masks, if they're exposed, that's what I'm trying to say, then they are going to get down faster. Of course, even the people who are elderly, also their immune is compromised because they might not have the same strength as a young man or woman would have in fighting diseases. But we're also cognizant of the fact that even the young ones right now, with the given variants, they are also getting exposed. But with regards to taking medicine, with regards to hypertension, diabetes, you still keep on treating those diseases, but add on this vaccine. The vaccine is not a treatment, but it is a tool to enhance your body to fight diseases. The vaccine actually comes from, the virus is weakened or attenuated. It's a dead virus. It cannot give you a disease. It is just used to trigger, to program your body, hey, these are the soldiers. Now the immunocomponents in the body, they are soldiers waiting. They're like policemen. They're just chilling there, patrolling. How is everything out there? And if they find there is an entry, maybe you've just breathed in. You've breathed in some
enemy.
I'm just trying to make it
Yes,
funny.
Indeed.
Those soldiers will go there and fight it. But now if you do not have those soldiers to fight, then you're going to shut down faster, especially if you're old or if you have a comorbidity like cancer and hypertension.
Right.
But those who have the vaccine, the body has been given a message. It has decoded and known that in case this kind of attack comes, we shall send the red beret, all these character to go and fight. But if you don't have the vaccine, you'll be caught flat-footed. So you're saying take this vaccine on top of washing hands, on top of not social distance, physical distancing, and on top of washing hands with soap and water. So those are the things that really matter, plus the vaccine, you're good to go. And also pray. Because also when you have a vaccine, by the way, you can still get the disease. However, the severity will not be as crazy as that person who doesn't have the vaccine.
Yes, you've mentioned something very good. So is the vaccine a license to go party?
Good question. WHO has said it very clearly. The vaccine is not a magic bullet. In fact, I usually say there are 3 golden rules. Sanitize or wash your hands with soap. Physical distance and put on your mask. Plus this vaccine. Those are the key things. So the vaccine should not cheat you to now say you don't need a mask. You actually need to mask up. And guys, if you're worried here, we have social distance. Don't mind, are we preaching water and drinking wine? We have social distance here and there's a lot of air right here. So the vaccine does not mean, now Easter is coming. Doesn't mean that now you need to go and mingle with your relatives. You might be exposing your people. You might be exposing yourself. So the vaccine doesn't mean that you change anything. It's just enhancing. As to protect ourselves against
Yeah.
this particular.
Maybe I can add something to
Yes.
that. So some people are talking about immunity from the disease. Having got COVID actually gives you some immunity, but we don't know how long it lasts, and it varies depending on severity. So we can't really assume that you have sufficient immunity. So as Ken said earlier, we still need to get the vaccine, and we still need to get both doses of the vaccine. So I know some people after getting the first dose are feeling, invincible. We are not invincible. What has been studied in terms of the efficacy or, how effective the vaccine is in preventing the disease is actually, let's get both doses. Two, even after getting so that doesn't mean you will never catch the virus. You will never get COVID. So you might still get a milder version, but it's almost 100% protective against severe disease. However, that means you can still get it and pass it on. We are still studying among the communities where you have a significant proportion of the population vaccinated, but we still need to be our brother and sisters keepers. So somebody next to you might not have been vaccinated. You could still catch a mild version and infect them until our data tells us more. Please, let's still continue. When you're meeting other people, of course, if you're living with somebody in the house, you don't have to wear your mask and everything, but in other places where we don't know, let's continue to use those things, including the masks.
I think I like the fact that you said that you still can get,
But a mild version.
but a milder version.
Yeah.
Supposing some people opt out, do you have that way to opt out of the vaccine?
It is not mandatory. I think it needs to be clear that honestly, generally, we don't health interventions. For ethics reasons, you can't force them. I think it's very useful if a significant proportion of us, say at least 70% of us are vaccinated, because we have what we call herd immunity, where if, say, 3 of us here are immune because of the vaccine, and maybe you're not, if we go out there and we expose, the risk of us actually catching the disease significantly to spread it is actually reduced. So that's what we do with measles and children's vaccines. We want to cover as many people as possible. So it is not mandatory. I know that's another reason people are saying, okay, I won't get it. Why is it being pushed on us? It is not being pushed. I think honestly governments are acting responsibly by bringing this vaccine, because one, you want to save your people, but also two, you want to save the costs. It's extremely expensive to have COVID on the healthcare system, whether it's a person paying, whether it's a government paying. Three, all these shutdowns are also very expensive. People are losing jobs. So the government and governments around the world are acting responsibly by bringing the vaccine, by promoting it, by helping debunk these myths. But it is not mandatory.
It is not mandatory.
It is not mandatory.
And yet it's free also.
It is free. We also have a few, I think, that have come in that are a different vaccine in the private sector, but really, generally, the vaccine that is available to most of us, including what I used, is a free one.
It's free.
Yeah.
So it's a responsible thing to be a responsible, accountable citizen, so that you don't not only get infected, but you don't infect someone else should you have the virus.
Absolutely.
I just wanted to also add, from a business point of view, you see, you do a cost-to-benefit analysis in everything. So when you look at the economics of it, right, it's actually, just think of a government just like your house, right? The way you budget your income, your revenue, your income and your expenses, your rent and the like. That's how governments behave as well, right? They look at the costs and the benefits. So it's actually better to actually promote vaccines and actually not put a cost burden on the end user, on the beneficiaries, because it's a lack of revenue. If you don't do that, if you don't address that, you don't get revenues. Like what Ken had mentioned earlier, last year, right? When everything was shut down, people lost jobs, right? People are not able, there's a ripple effect. People are not able to pay rent, the economy shuts down, it becomes a cost burden on everyone at every level, right? So what is a $3, I think the cheapest one in AstraZeneca is about $7 or something. What is $7 compared to billions of dollars in lost revenue on a daily basis? So those are some of the things that now encourage governments to actually say, no, it's actually cheaper, right? It's just like, it's cheaper for me to wear a jacket, a jersey when I'm cold, than to buy cold medicine. that's how you should look at it. Yeah.
And you know, I found myself, talking to an elder relative who was reluctant, and she's asking me, so where will we be injected? Is it where they were injecting smallpox? I don't know in Kenya where they were injected, but this was someone from another country. So I'm like, you see now, you're actually afraid of clearing this COVID, but you guys accepted the vaccine and cleared smallpox. So we didn't have to get smallpox vaccines, We managed to eradicate several diseases, save many children from polio and the complications of polio, including, having walking, disabilities and so on, because we accepted, and they were safe. I mean, if there are any safety concerns, honestly, you should see the vaccine approval processes. It's approved by, you have to do clinical trials. It's approved in the country in which the company is. Then WHO also just checks before they actually, before pre-qualification, so they can advise countries, this one has been approved. They've gone through all the processes. Then it comes to Kenya, and Kenya doesn't just look at what WHO has said. Our own systems for vaccine advisory groups, say, is this vaccine safe? Do we want it to be given? So there's a whole long process before actually. I know many of us wonder, does our government do that? It actually does work. It actually checks what's being approved in this country and then goes ahead and says, you know what, it is safe for our people, you can go ahead. So remember smallpox, if nothing else, we were able to, to eradicate quite a few diseases.
Doctor, with all due respect, I think one of the questions that was asked is that given the fact that this virus is new, data, the question of data has been raised by people. Is there enough data for governments to base their decision on that let's give this vaccine, and yet vaccines traditionally have taken longer time to have trials done on humans so that they can now tick it and say this is safe. So within the limited time, is it still possible to say it is safe?
Yes, okay. What I will say is, traditionally vaccines have taken very long to develop, and we've got different technologies of developing vaccines. Some of the technologies that we've used for this, that have been used for this round of vaccine development, have been tested, I think, for decades, like the mRNA, whatever, has been a technology that's been developed for a long time. But this was an opportune time for it too. So they were able actually to take advantage of the research that has been going on. Others are old technologies. For instance, what Ken mentioned, the attenuated virus, the weakened virus. We have used this for many, very many vaccines, even in our children's schedule. We also have others where you modify a safe virus and just give it something that the body will recognize as COVID so they can develop antibodies. So these are tested methods. So one. So sometimes some research has taken place in the past that now we've been able to take advantage of. But two, some of the delays are in terms of trying to get funding, because honestly, this research is extremely expensive. But governments put down money. They actually prepaid and say, or just put aside money and said we will pay for this. So that actually significantly hastened the process. I honestly think, based on my understanding, I've looked at some of the, the literature on the whole clinical trials, and they actually go through phases. I don't want to go into the details, but actually you go through a phase where you try this on, lab rats and see. Well, first of all, try and see whether does it actually elicit an immune reaction. Then you try on people, generally healthy people, to see. Does it, what is the correct dose and what is the safety profile on healthy volunteers? Then once you've determined, the dose and the safety profile, then you go to another stage of the clinical trials. You're actually checking in the target population, does this work?
Right.
And so you're checking all these things. In many diseases, it takes really long because the disease is not as common, to actually see a significant difference between the group that is not being given, because we have a group that gets maybe a placebo, which is not the vaccine, versus a group that gets the actual vaccine. So we track and see how many people are developing the disease. But COVID was actually very prevalent, so it was very easy to quickly see the difference between those who get the vaccine and those who get the disease and those who don't get between those, the two groups, how many cases are there. So when you have a very prevalent condition, you can actually get the data much faster. And also, these methods of vaccines have been found to be safe. So in the past, I don't think that was a big concern, because we have used, like I mentioned, attenuated viruses and so on and so on. So I'm not worried. Definitely, we will continue tracking. And it's possible that actually you realize maybe somebody has got an adverse reaction, an allergy reaction to one of the compounds. And if you're prone to allergies, maybe I should have answered that. If you have if you've ever reacted to a vaccine, or you're prone to significant, serious allergies, then discuss with your doctor about getting the vaccine. But one of the things that countries around the world do is we track. If you develop any symptoms, have that reported. Because it could be the first time it's happening in the whole world, and we need to know, and countries need to know, and the manufacturer needs to know.
Okay.
So if anyone finds anything, I have seen, I think, a contact from Cambridge circulating, but even just telling your healthcare provider, it'll actually make its way up, and we will know what to do.
I can quickly chime in on that. Very good points, Frida. That also the acceleration for this vaccine was also contributed to by the social media engagement, and they got the volunteers pretty much fast. And also the fact that this pandemic has been growing and spreading very fast has also contributed to us having these results were seen very fast. And for the Pfizer vaccine and the Moderna vaccine, they skipped the lab processes. So that's why they were faster to get results and very easy to replicate and scale.
Right.
Though, given the temperatures we mentioned, AstraZeneca is the best for this part of Africa. There was a point that Tapu was said as an entrepreneur, and I really wanted to weigh on it, that our governments need to look at the return on investments. Most of the time, we are usually reactive as the health system or as a community. And vaccine is a great public health intervention. But before we get to it, we find that it is very easy for us to invest in ventilators, for example, or oxygen, or things that are done in the hospital, or employ more doctors, more nurses. However, as a public health specialist, I usually have one conviction, that to be great for our health workers, and especially our health workers at policy level, to have a paradigm shift and focus on prevention, not just by talking about it, but putting money where the mouth is. We need to invest. For example, you can imagine, like what you've just seen the other day when our president took in the vaccine, you can see the impact on that. So if you can even have social media influencers, musicians, leaders, bishops, going to the public and talking about hand washing, for example. You don't have to wait until the fourth wave. Now, this is the funny thing. We are very reactive. Now we are all running, masking up and doing everything. And then when it goes down after 6 days, oh guys, now you don't have to wash hands. You can unmask now. And then June, maybe August, July, when it's a bit cold, and maybe you are having a fourth wave. Hey guys, you have a mask, So we need to invest in consistent behavior change. The challenge with behavior change, people don't see the tangibles. Just like you don't see the virus, you just see it in a lab. We all believe it is there because nobody has seen it. But we're believing on the process of science. And the thing is just to keep at it and preaching behavior change and invest in it. The returns are great.
Thank you so much, guys. That's all we have time for today. Unfortunately, we'd have liked to have a bigger conversation, ask questions like, is there really a fourth wave, another wave? We don't know. So preparedness is an issue we could have had a chance to talk about. And you mentioned the need for policy to address the prevention issues ahead of time. But basically, that's what we have time for today. I can't thank you enough for your time and for shedding light into this difficult issue. It has disturbed many people. You've allayed many fears. We are happy about that. We've debunked some myths there. It's a good thing, and I do feel like more informed. I feel like I can make a better decision. And I feel that's where we are now at this point. We leave the show feeling more informed, feeling more appreciative of our professionals, because we get a professional view, and it's something we can rely on. We can take it to the bank, as it were, because it comes from the mouth of an expert. But should you have more questions, please don't hesitate. Let us know, and we'll see you next time. God bless you, and have a great and free and safe week ahead.
Thank you.